Hello, listeners. I am excited to be with Dr. Eric Endlich, a clinical psychologist who specializes in college consulting and providing guidance to families looking to get help finding colleges, accommodations, and interventions within the college process. And here we are. How are you, Dr. Endlich?
Great. Thanks for inviting me. I'm glad
Of
to be here.
Of course, I understand that you are also a Dr. E.
Yes. I have had people call me Dr. E or Dr. Eric, since Endlich is a little harder for some people to memorize. So, yeah.
Yeah, that's how I got the Dr. E too with that last name. So there are two Dr. E's today. Our listeners are probably pretty excited about that. So we're gonna, kind of get started. There's a lot to talk about. We have a really large population of teens, adults in our practice. And so, of course, as the teens are going through high school and we're having to think about college, parents get, concerned. What do we do? How do we get accommodations in college? How do we get help for college? They're very nervous, and obviously the kids are nervous too. So I thought it would be a really good idea to kind of summarize, the college accommodation process for our kids that have challenges and disabilities and diagnoses that really do need to be accommodated in college. So how do college accommodations differ from K through 12?
Yeah, great question. So almost all the students we work with have disabilities and in many cases are applying for disability accommodations in college. Although keep in mind, not all students who go to college who have disabilities report that or disclose it or seek accommodations. The laws are different from K to 12 to college. So it is sort of a clean break. It is kind of a fresh start in the disability world. And that is something that parents need to know. So there's a lot of myths that keep floating around. I co-manage a parent group of 20,000 plus parents, and some of the same myths just keep coming back, like, my 504 in high school is going to carry over to college. Nothing carries over. You can absolutely get disability accommodations in college. In fact, sometimes more than you can get in high school, but it's a different process. Couple of key differences. One is each college can set their own sort of rules for what documentation students need in order to get accommodations. So this is a common question that comes up. What do I need in order to get accommodations? Will a 504 plan from high school work? Do I need a neuropsychological evaluation or a letter from a doctor? Each college sort of sets their own rules. So in some cases, they might say you need a neuropsych evaluation and it has to have these specific tests. Another college might say, we'll work with whatever you bring us, whether it's a 504 plan, a letter from a doctor, a neuropsych. So the documentation can vary, but that information is usually available on the website, or you can reach out to the Student Disability Services office at the college and find out what's required. And sometimes they want it to be recent, within about 3 years of starting college. So if your last evaluation was, 5, 8 years ago, that may or may not fly. Even if it is acceptable, keep in mind kids change a lot. So sometimes an updated evaluation can be super useful. So that's the accommodations piece. Other piece that's really key for students and parents to understand is that the burden really shifts to the student to be a self-advocator in college. So prior to college, the parents are often kind of driving the bus or kind of on the front seat, as it were, speaking at the IEP meetings in high school, communicating with the staff at high school. I'm a special needs parent myself, so I've been there. I know how that can often work. But when they go to college, when your student goes to college, the college is going to treat the student like they're an adult, even if they're not, chronologically yet an adult, although they often are. And they expect to communicate with the student, not the parents. They typically don't want parents coming to meetings or reaching out to them. And if the student needs something or they're encountering some difficulty, it is incumbent upon the student to step up and reach out to staff to say, hey, I'm having an issue getting this accommodation. So that's a really key difference.
And that's really interesting too, because one of the biggest challenges for this population is social communication. So here you have high school students that are needing to advocate for themselves, which is one of the key challenges that kids with SM have. They often lack the ability to initiate their needs, even non-verbally. Of course, this is an area we work on in therapy and will help them with the process. But this is something that really scares a lot of families because it is about the kids having to make those kind of moves and initiation. So again, that's something that we need to realize is that is a disability for them, their ability to get that going for them. That's a real challenge for them. So I know that so the process of asking parents or having parents be part of that from the beginning, is that something you recommend from the beginning? Because if you can get the parents on board, do you typically see, I mean, at least I have seen, but I wanted to know your opinion. This is what you do all the time, getting parents involved pretty early in the process. Although I know independence is critical for kids. I do, but it's also about the kids not necessarily knowing how to do it.
Yeah, well, there's definitely a lot of communication when we're working with kids on the college application process. Part of what we're doing also is looking to see if they're ready for college and what skills they need to work on in high school in order to get ready. And parents do play a key role in that because, again, parents are often doing a lot, whether it's waking the kids up in the morning, reminding them to finish their homework, doing their laundry for them, telling them to shut off their phone and go to bed, whatever it might be. Parents are often highly involved in high school. And it's important for parents to for all of us to sort of work together to gradually shift that burden of independence, self-advocacy during high school, so that when they go off to college, presumably if they're going to, live away from home, that they have more of those skills in their toolbox. Now, of course, there's the option to stay at home and go to a community college. Not all kids who go to college move away from home, but that's sort of the most challenging situation that we're talking about here.
I would say that building independence is something from the very start. Often families come to the center and they really are help my child talk in school, help my child become verbal. But yet there's all these other aspects to who this child is, and lack of independence is usually common. And because the kids have trouble with social communication, that kind of shadowing their parent, shadowing their siblings, not being advocating for themselves, and the independence that most high school students start to kind of naturally have, this is definitely a challenge. So we work on this in therapy for sure. And it's interesting you said about home versus away. That's something that comes up a lot. There's parents that are like, yeah, I want my child to live away, or I want them to live home. And I think there's some key aspects to making that decision, because I've had parents say, I think she's ready to go. But meanwhile, like you said, she isn't getting up on her own. She isn't able to have her needs met at all. She's really dependent on parents. She doesn't have the ability yet to make friends, because we get a lot of kids in the teen years that have been going through this for years. Of course, if they've had treatment earlier, it's a different story. But I'm talking about families that kids are really getting treatment now for the first time sometimes, or have been in the wrong treatment, or it hasn't worked, and so forth. So we're getting kids with all different.
Yep. And I don't want to be clear, this is not sort of a black or white situation that you have to have all of these skills completely mastered. You have to be totally independent in order to go off to college. Of course, independent, we're, even as adults, we're interdependent. No one's completely independent. But it's also not black and white in the sense that you just have to kind of have these skills and go to college and make it work. You can go to college readiness programs during the summer while you're still in high school, or there's some that take place during the academic year. You can take a gap year after high school and go to a college readiness program. There's some that are specifically for students with learning differences. Or you can get robust support while you're in college. So you have those supports to help you continue to build those skills. It's not a matter of sort of sink or swim once you get to college. You can go to a college that has a robust, comprehensive learning support program, or you can hire an external program to supplement what the college offers. There's a lot of different sort of pathways and ways to make this work.
Right. That makes sense. How do you locate a college that offers accommodations? That's not easy either, because as you said, all colleges are different.
Yeah, well, to be clear, so I think of sort of three general levels of accommodations and levels of support. The most basic, we're talking about for the sake of this discussion, colleges in the US, which is what I'm most familiar with. Different countries have different systems, but in the US, for all practical purposes, every college will offer disability accommodations by federal law. So if you are entitled to accommodations, whether it's for a learning difference, a physical disability, colleges are required to make reasonable accommodations, just like workplaces. If you're an adult in the workplace, your workplace is most likely required by law to provide reasonable accommodations for disabilities. So that's kind of the foundational level that all colleges offer. Whether all colleges do that equally well is a whole other question that we can come back to. Then some colleges offer additional services. I think of them as sort of a la carte services. Maybe they offer, let's say, academic coaching as a common accommodation for students who have executive function challenges, who struggle with time management, deadlines, organizational skills, which is true for most of the students we work with. So some colleges have that additional service here and there, maybe free, maybe at additional cost. And then the highest level would be a comprehensive support program, a learning support program, or an autism support program that has multiple components to it. It may have academic coaching, but it may also have peer mentors. It may have social events. It may have meetings with a learning specialist, kind of a robust, comprehensive suite of services, frequently at an additional cost, not always, but in many cases, it's thousands of dollars a year above and beyond what you're paying for college. And if you're wondering, like, well, where do I find those programs? I have created a database that you can find on the Top College Consultants website. That's topcollegeconsultants.com. And there's a database of over 200 colleges that you can sort by state. If you're just looking for colleges in Texas or Wisconsin or what have you, you can sort it and see which programs have additional support in the states that you're interested in, and what those programs cost. And there's a link to those programs and so on. It's not commercial. Nobody's paying me to do this. I just created this as a service for free service for families.
No, that's awesome. So the majority of kids with SM have obviously anxiety, social communication anxiety. A percentage of them have some learning challenges, specifically in the area of processing. Like you said, there's other difficulties that they may have as well in learning because every child is unique. Some individuals are on the autism spectrum and have SM as well. Some have speech and language. I think the percentage obviously is different than the younger children because they develop the skills, but speech and language is a factor that we see in these kids with SM. But I'd say the mental health aspect is, a big one here. So are there specific colleges that you can kind of search out that have a stronger mental health, kind of support program than others?
That is definitely something that's important to research. It's a moving target. It's changing all the time. Certainly with the rise that we've seen in mental health challenges for teens and incoming students, colleges have generally been stepping up and providing more services because the demand has just skyrocketed in the last few years, particularly with the pandemic. And again, if you go to on any college tour and you ask about this, it's pretty common for colleges to have free mental health counseling available to all students. But the devil's in the details. You want to dig further and say, well, what does that mean exactly? When you say you have free counseling, how many sessions are available? Is there a maximum number per semester or per student total, in their college career? Do you provide medication prescribing? Who's providing the counseling? Is it licensed professionals? Is it graduate student interns? And is there a wait list? Is it individual or group? So you want to kind of dig into the details to understand what that really means. And you can also chat with other families who have experience with that college to find out, hey, is it as good as the college says it is? And I find that, for parents communicating with each other is super helpful. I co-manage a Facebook group of parents that's currently over 20,000 parents. So that's a great place for parents to find out, hey, we're thinking about this college. What do other people know about it? Sometimes parents are communicating in local special education parent groups, CPACs or SPED packs as well. But some of these social media groups can be a super helpful way for parents to learn about that.
Yeah.
And even if there's, decent resources in the college, sometimes students are still going to be getting additional resources from outside of the college. Maybe it's because they don't want to stop with their current therapist and they want to continue with that therapist. In that case, you really need to look at, are you going out of state and can they work with you outside of the state that you're currently located? That's a whole licensing issue. Also true for medication. But that's something, sometimes students are getting off-campus supports, which is totally fine. We're talking about professional services, but there's also things like mental health clubs or peer support networks that you might look at. So a lot of colleges have some of these mental health-based clubs, like Active Minds is a well-known chain of clubs in colleges around the country.
That's great to know. As far as selective mutism and how it affects college, we do have to accommodate a lot of the learning challenges that some of these children may have and their communication. For example, social engagement, communicating with teachers, with peers. This is really difficult, making friends, keeping friends. Those things are like the basic kind of types of things they're challenged with in class as far as participation, speaking up, giving presentations, being able to initiate with the teachers, being able to reach out to the teachers in any way, like having these sorts of accommodations. When you hear some of the things I'm saying as far as communication, can you give us some examples that you've added as far as some accommodations for kids that have communication issues? Like you mentioned autism, although the far majority of kids with SM don't have autism. Kids with autism obviously have challenges in some of these areas as well. So can you share some of the types of accommodations that you've kind of written for families just to give them an idea of some of the areas that they can get accommodated?
Sure. And I relate to a lot of this. I struggle with lifelong social anxiety, and it's possible as a child I would have been diagnosed with SM if people had been on top of that. So I understand that, and self-advocacy, is I get the challenges with that, both for myself and for one of my kids. I'm not involved in kind of the formal accommodation requests, although we can certainly talk with families about what would be helpful. We look at what are they getting in high school now and what do they feel they need in college, and also what have the professionals recommended. So ideally you want some documentation from a professional that says, I recommend that in college this student get the following accommodations. Sometimes, let's see, a single room in the residence hall is one that families may not have really thought about prior to college, because unless you're going to a boarding school in high school, it wouldn't really be relevant in high school if you're not living in a dorm or a residence hall in high school. But there are accommodations in college that are not academic, that are in the residence hall or the dining hall or mobility around the campus. So that's something to think about too. Accommodations is not just in the classroom, it's not just academic, it's broader than that. And from mental health, accommodations could be an emotional support animal to live with you in the residence hall, which again might go along with a single room, depending on what the animal is. There might be accommodations like being able to take time for therapy, might be, some flexibility around the schedule, might need to have classes at certain times. Sometimes priority registration can be a helpful accommodation that a lot of colleges offer. There's lots of accommodations around reading materials, speech to text, text to speech, getting professors' notes, getting recordings of lectures. But working on those self-advocacy skills so that you can talk to your professor or talk to your roommate, get the help you need in college, whether it's from a tutor or counselor, super helpful for all students.
You brought up single room, and sometimes when I bring that up to our families, they'll say, well, I don't want my child to have a single room because it's really important that he or she socialize. And I say, absolutely, that's one of the biggest hallmarks is the need for socialization. But a lot of our kids with SM have sensory sensitivities. Like you said, social anxiety is a big part of selective mutism. And so sometimes what I've experienced is that they need that downtime. They need the time away from, and also the roommate situation may not always be ideal. And so it becomes another stressor for them. And what I tell families is that the kids can get their socialization through clubs and activities that we help them with. to find those so I'm an advocate of a single room, at least the first year, unless the family's like absolutely not, or they're going with someone they know and they're comfortable, or they have enough confidence, social communication confidence and skills to be able to be in that room. And I think that's where working with a treatment professional that knows that child is so important, because I often have to guide them in this process. So a single room is definitely something that I see as a positive. Also, the emotional support animal, that's been going along really, really well too. It's also something that they can have to share with others, where it's like an attention off them, because we know with social anxiety that kind of attention on them is difficult. So having an animal, walking the dog, if that's possible, and they have the responsibility skills to be able to take care of that animal, that's another accommodation. I just wanted
And
to kind of
that may trigger social engagement too. If you have a
yeah,
dog on
exactly,
campus and you're out and about walking your dog, there's a good chance people are going to stop you and want to,
exactly.
oh, can I come to your room and, hang out with your dog, and ask you, what breed is your dog? So that can trigger a lot of social engagement. Going back to single room for a second, yeah, it's something that's worth a longer discussion, because there are those sort of pros and cons that you highlighted. I also have social sensory sensitivity. I would have been much happier in a single room in college too. And as you said, I'm with you on that. There are sure, if you get along with your roommate, if that works as a potential social opportunity, great. But the roommate's just one person. There's thousands of students at college and many ways to connect, whether it's clubs, classes, sports. So, or just, if you're a friendly person, just whoever else is sitting in the dining hall, if you're outgoing. So you don't have to rely on the roommate as that one way to build a social life. And if you're living in the residence hall without a roommate, you walk out of your room, there's a whole bunch of other students there. And depending on the climate and whatnot, students may be out lounging about, they may be hanging out in a common space. There's going to be a lot of opportunities to build connections within the residence hall, even if you have a single room.
Yeah, no, for sure. Like I said, I'm an advocate of that. I've seen that work better than not. And it's interesting. One of the strategies that we work on with kids is something called common questions. We want to minimize their need to think and process. So if somebody asks you a question, sometimes that freeze occurs. So if they can predict questions that are asked, it minimizes their need to think and process, because they prepare. So having a dog walking around campus, like you said, what's your dog's name? What kind of breed is it? How old is your dog? And so they're ready for these questions, and then they prepare their answers. That's a really key strategy. Action plans. Where are you going? Who's going to be there? What questions can be asked? What are the answers? What could you ask? And so we help the kids navigate these kind of conversations in all the situations. And so when we brought up that animal situation with emotional support, I'm like, wow, that's a perfect opportunity to continue that with the kids. I do want to talk about academic accommodations, because within K through 12, we're constantly writing IEPs and 504s and having accommodations for the kids. And I want you to touch on this, because you hear about college accommodations, but you don't hear interventions. Whereas K through 12, there's interventions that the teachers. Can you touch on that? Why do they not? Well, not why do they not, but
Yeah.
it's not really interventions, right?
Right.
It's accommodations.
There's no special ed in college, period. So
Yeah.
in K through 12, there's special ed. There's special ed services. If you're on an IEP, you can get all kinds of services, speech therapy, OT, PT, you name it. That goes away in college. Again, it's a completely different set of laws. College, the burden in K through 12 on the school district is to help the student make effective progress. So the school district is responsible for ensuring that students progress and are successful. The emphasis is on success. In college, it's a much sort of lower bar. The emphasis is on access. Here's the curriculum. We're going to provide accommodations if you need it, so you can access the curriculum. Maybe it's a recording of the lecture. Maybe it's, help physically accessing the building. But we're not doing anything to ensure that you're successful. Here's the curriculum. Here's the accommodations to help you access it. But it's up to you, the student, to be successful. And if you're not, that's on you. That's a different mindset from K through 12. That being said, as I said, some colleges do have more robust services like a learning support program that you can access, sometimes at an additional cost, to be successful. Or you hire your own folks from outside of the college, whether it's an academic coach, speech therapist, whatever it might be, to help you be successful. The other thing is there may be, even though it, what I just said makes it sound like, oh, college is sort of less than high school or K through 12. There may be technology and accommodations and resources that you have not encountered or even heard of because the school district didn't have the resources that a college of 20,000 students does, because they have so many students. They've spent the money to buy this piece of technology. So there may be certain kinds of assistive technology available in high school. Again, screen readers, speech to text, text to speech, you name it, that maybe, certain technology that you didn't run across in high school.
So in college, you'll have these types of special kind of accommodations and technology that you didn't have access to, is what you're saying.
You might. Yeah, it depends on the college, but that certainly can happen. That's why those discussions with colleges are so important. It's a two-way conversation with them saying, well, what accommodations do you need? And you can also ask them, well, what assistive technology do you offer? What do you got? And some of that's maybe listed on their website, but certainly in a dialogue with them, you can find out more. Here's my challenges. What are some of the things that other students with similar challenges have accessed previously?
So let me ask you a question. So a lot of kids do best when a professor or a teacher, asks them more choice questions or allows them to write and read their answer, avoids open-ended, thought-provoking questions, especially as the individual is getting comfortable. These are things that you really can't write in a 504 in college, right?
Yeah, so to be clear, although you can get accommodations, you don't get modifications in college for the most part. And in high school, in K through 12, there are accommodations, modifications, and services. If you're on an IEP, you may be getting accommodations, modifications, and services. But the school district doesn't necessarily kind of separate them out. They're all kind of mushed together. So you're getting accommodations. You get extra time on test or test in a distraction-reduced environment. And you get a modification that, unlike the other kids, you don't have to do as many problems, or you don't have to write the paper, or you don't have to do the presentation in front of the class. You can write a paper instead. The actual assignment is modified, a different assignment for you, the student with a disability. And you get services potentially, like I said, speech therapy, physical therapy, OT. In college, accommodations, for sure, that's almost always available with the right documentation. Modifications, almost never. So it'd be very difficult and unusual to get sort of a different assignment or a lower bar, because the curriculum is what it is in college. It's, if it's a college introductory biology course or composition course, the curriculum is what it is. Every student has to meet that bar and meet that standard to get the grade and graduate college.
Yeah, that's really, really interesting. I did have a college student that was very much an advocate for themselves, and they had some expressive language challenges, and they actually wrote to their professors and said, hey, it would be really helpful when you ask me questions if you ask me more choice and direct questions and try not to ask me open-ended questions. And if it's okay, I'd like to write and read it to you because that's easier for me than to say it to you. And in every case that's happened where they did it, I guess, outside the 504 in college or the accommodations, the plan, it worked. So it helped.
Great.
So it might be, so it might be right.
This touches on a few key things. One is the self-advocacy that we spoke about. So this student clearly was self-advocating for themselves. Super important. That's how you get your needs met, in part by self-advocating. Secondly, there's the culture of the college, right? So not all colleges are equally inclusive or welcoming of students who are different or students who have disabilities. And that's not something you can really find in a list. Parents have actually asked me to make a list of the colleges that are super inclusive and welcoming, but it is so subjective. But that is something still worth researching when you're on the campus. Talk to students and faculty. Talk to and try to get a read from other families on what has it been like for their kids to know, do professors go that extra mile? At some colleges, I think they do. At other colleges, not so much. At the end of the day, and this is the last thing I'll say about this, I think professors are human beings. They're individuals. So even though you may not have that accommodation formally on paper, officially, that you can say, hey, you have to give me this accommodation, you can always have that conversation on a case-by-case basis and say, hey, I know it's not written into my list of accommodations, but it would really help me if you could do this. Is that okay? And an individual professor is free to say, sure, that's no problem. On the flip side, if you do have an official accommodation, say testing in a separate room or something, and a professor ever gives you a hard time and says, oh no, I never do that. I don't do that with my students. You have rights. You can go back to the Disability Services Office and say, hey, help me out here. I'm running into an obstacle. Hopefully that's a very rare occurrence. I would, hope that it's more the other side where professors are even more accommodating than they are required to be.
Right. No, that's great. And I think that's a great point for families, not to get so locked into things, but kind of the individual aspect. When I talk about the impairments, I think it's important for our listeners. They're probably thinking, well, what is it that we say to the college, right? Not just that we have a diagnosis. And some of the areas that we talk about is just saying that they have significant difficulty speaking during large group presentations. That's important. Answering questions during class and or doing like audio or visual recordings may be something that they can do. So separate. They often have difficulty engaging in reciprocal social interaction with unfamiliar peers or adults, and deficits for some kids, especially those that are on the autism spectrum or social communication pragmatic disorder, understanding and utilizing nonverbal communication, kind of that social puzzle that's difficult, and developing and forming and keeping social relationships. So those are the areas that we tell families kind of when you're going to the schools to kind of let them know those are the areas. And then in terms of learning, again, the most common that we see is difficulty with processing, like central auditory processing disorder. Some have ADHD, some have executive function, working memory. So knowing all that in advance, so having that testing, like you said, because they're not going to do the testing like they do in high school or elementary school. You have to get that from a private evaluator. So I think having all of that really spelled out for families to have that. Don't you recommend that? You said what, within 3 years?
It's not a standard thing across the board. If you have an evaluation within 3 years, I don't know of any college that has a requirement that's more stringent than that. I think the vast majority of colleges would be fine with that. But again, some colleges are super flexible and would say, oh, all you have is an evaluation that's 6 years old. Okay, well, if that's all you got, we'll work with that. So that comes down to the individual college. I think there's advantages to recent evaluations to really understand what are your students' needs now, and to get it in writing from a professional who says, I recommend that in college, this student get the following accommodations. Then you've got, a strong, robust document to bring to the college and say, hey, a professional said, I need these things, so hopefully I can get them. With disclosure, the question is, when are you disclosing and who are you disclosing to? So I get a lot of questions about disclosure during the college application process. Should my kid disclose a disability or a diagnosis when they're applying to college? I've written and spoken on that. It's a kind of a complex topic, but the short answer is it's really up to you as the student. It is entirely optional whether you disclose a disability when you're applying to college. You can apply like any other student and not disclose it. You don't have to, but there are certain cases where it can be helpful to, especially if there's something in your transcript or in your high school career that might be concerning or puzzling to a college, and you have the chance to explain it. Here's why I switched high schools. Here's why my grades went down. Here's why I took a leave of absence. Here's why I didn't take certain classes in high school. For example, I have students who didn't take foreign language classes and they're applying to colleges that say they require foreign languages. So there are a bunch of situations where it can be useful to explain things and to disclose a diagnosis when you're applying. Then once you've gotten in, there's that whole set of opportunities to potentially disclose. Do you disclose after you've gotten it? Well, if you want to get disability accommodations, you have to disclose. You can't get accommodations for a disability you haven't reported. And you can't get disability accommodations retroactively. So if you've taken a test and didn't do well on it, you can't say to a professor, well, I should have gotten accommodations because I have a disability. So you want to get those lined up in advance. Then there's disclosing to peers. If you do struggle with conversations and reciprocal social interactions, do you tell your peers that? Or do you just kind of let them have those challenging interactions?
I would say they don't. Like the majority of even my high school students don't even want their teachers to know, let alone.
Yeah.
Well, I think what happens is as they're getting ready to go to college, we sit down as a family and we talk about, should we start college? They have enough skills. They seem independent. Their social communication skills have improved tremendously. Some may not even meet the outright criteria for SM. They may be more socially anxious. And so in other words, we realize, wait, let's start college, work with the student throughout. I do a lot of consulting. We do a lot of consulting, like as therapy throughout the college experience, starting, joining clubs, how to do it, conversation starters, if they have needs to go up to the professor to get their needs met and so forth and so forth. So we kind of work through it as they're moving through the college experience itself. So we don't always get formal accommodations, but if there's a specific learning issue that needs to be accommodated more than anything, I'd say it's majority of kids with learning challenges that we need to get this more than the social communication, to be honest. Most kids with SM, by the time they get to college, hopefully have a voice in some way. They may not be the chattiest person. They may not be the most elaborative initiative person, but they can speak and usually respond. So it's really around their learning. And then, of course, the possible single room support animal and so forth. Kind of sitting near the professor, sometimes closer. Sometimes accommodations for missed work if their anxiety is really high, trying to be paired and grouped with the same peers. The fact that they do have difficulty speaking up, we talk about that, and maybe handing in a report versus an oral report that they have to give, extra time to take an exam because of their anxiety or a different room. And then, of course, accommodating their specific learning challenge that they may have, like, for example, auditory processing or something.
Yeah. You mentioned that not all students seek accommodations. Just because you have a diagnosis or a disability doesn't mean you have to seek accommodations. If you can thrive and be successful and do well in your classes without an accommodation, that's totally fine. You also sort of alluded to more informal accommodations like sitting close to a professor. If there's something that doesn't require an official accommodation, an official letter saying that you have to have the opportunity to sit next to a professor, you can just sit near the professor. So sometimes the so-called accommodations are sort of self-created. I know, for example, a professional colleague who wears a baseball cap to shield his eyes from the lights that he's sensitive to. That's, he doesn't have to ask for an accommodation. He just puts on the cap. And there's also kind of informal interactions like students talking with peers. You were saying, people often don't disclose. Well, disclosure doesn't mean necessarily telling someone your diagnosis. For example, let's say you're not comfortable with eye contact. You don't have to say, I don't like to make eye contact because I have this diagnosis. You can just say, hey, just so you know, I don't tend to look at people's eyes a lot, so please don't hold it against me. I am paying attention to you, and hopefully it's not a big deal. Or you adapt by like looking at their nose or something. So, but the point is, you can have kind of informal discussions about things without getting into the nitty gritty of what is your diagnosis. And that's true, by the way, for adults in the workplace. You can say, hey, I'm really sensitive to light. Can I have can I have my desk in this part of the floor and not over here, without saying, oh, I'm sensitive because I have this diagnosis.
Yeah. And just to be clear for our listeners, the reason I mentioned sitting closer to the professor was because when they are answering a question, many kids feel more comfortable where they're not speaking up across the back of the room all the way forward. That's sitting kind of where the professor mainly is. It's less that they need to kind of exert their voice. and they feel more comfortable, almost like a one-on-one situation versus talking up in front of a group. So we often make those accommodations sitting kind of near a professor or a teacher in high school or elementary school so that the teacher can kind of go up and reword it to them. But like you said, you can't really make those specific modifications or interventions in college. So the student on his own would have to, or her own, would have to make those kind of.
Yeah, and if it's a class of hundreds of students, it's going to be a whole
Right.
lot trickier, which
Right.
may sort of come down to what college you choose. If you choose a college of
Exactly.
1,500 students, maybe it's going to be easier to have those conversations and get some of those accommodations.
And there's kids that I work with that love a big school because they feel like they can, quote unquote, not be as noticeable. And then there's others that want the small school because they want to feel like they're seen in a different way and they're appreciated for, maybe their gifts in other ways and so forth. So they wanted that close one-on-one kind of, or a small group interaction. So yeah, you're right. Every single student is different, and knowing what their unique needs are, I think, guides this process. I mean, this has been super helpful. Choosing colleges is not an easy process, and it's very anxiety provoking. And what we try to teach the parents is try to maintain your calm in this, kind of fake it till you make it, because what you're projecting onto your kids of your own worries and fears is only going to make your kids more anxious too. So as a listener with a potential college student in the next couple of years, when would you say that they should start preparing? You mentioned like 9th, 10th, 11th grade. What's your thought?
Yeah, we love working with students on that college selection process. Really, the whole of junior year in high school, if possible, we devote to the college search process. So it's not a matter of like, you got to pick your colleges right now. We've got a lot of time when we start working with them in 9th or 10th grade, and we can spend all of 11th grade, in a more leisurely fashion, getting out and seeing a variety of colleges. And that college list can change multiple times. So sometimes students start out with, I heard about these colleges and this is where I want to apply. And then when they learn more, they decide, ooh, there's some other colleges I didn't even know about that look like they might even be a better fit for me. Or
So
students think they want a big college, then when they go and they see them, they realize, oh, I don't know if I want to walk that far, or whatever it might be. I mean, we prefer the earlier the better. The earlier families reach out to us, the longer runway we have to work on those college readiness skills, to figure out what the students' needs are going to be in college, to do that college search in a way that's not rushed. So by all means, and I don't really talk with students about college until junior year. So just to be clear, and I've had families come to me in eighth grade, even,
yeah,
as well as ninth grade. So if they come to me in ninth grade, 10th grade, we're talking about summer plans, building
right,
college
exactly.
readiness skills, possible career interests, choosing courses in high school, all the stuff that kind of lays the groundwork. Extracurriculars. Oh, you say you're interested in possibly engineering or theater. Okay, what are you doing now? What else could you be doing in high school to kind of set yourself up for a great experience in college? So we're talking about the stuff that's sort of peripheral to the college search itself. And then in junior year, we kind of shift into a higher gear and start looking at colleges and then, of course, applying to colleges. So earlier is better. We do get families reaching out to us, late in junior year, early in senior year. So you can start anytime, but if you start in senior year, you don't have a lot of time to work on college readiness skills,
For sure.
unless you're going to take a gap year.
Right. Well, this has been really enlightening, and I know our listeners are going to get a lot of information from this and probably calm them down a little bit when they're anxious
Yeah, that's
process.
part of why I went into this work. As you said, I'm a clinical psychologist. I was treating people for anxiety and helping people with stress management before I became a college consultant. And it's so stressful in this country. There's so many choices and it's so confusing. And we want to simplify that and help guide families through it so that it's actually fun. I love doing this work and it's fun for me, and I try to make it fun for kids too.
Well, this is awesome. I'll definitely be referring a lot of my patients to you that really need to kind of navigate this college process. I'm available for the accommodations and what's needed for the specific student. But as far as the process goes, I think you can really ease the way for so many of our families.
Great chatting with you, and I would be happy to collaborate.
Awesome. Well, have a great day, okay?
Thanks. Yep, you too.